Hi, I'm Steve Leon from FixWarts.com, and in the next 5 minutes I'm going to teach you how to use our compounded medications. Now, using them is very easy. They're not a cream, they're not a solution, they're a glue. So if you've ever used glue before, then you're going to have no problem applying it. The medicines you put on at night and you wash off in the morning, and you want to give them about 10 or 15 minutes to dry. So it's a glue, you want to make sure it's fully dry. You can accelerate the drying by using a fan or a hair dryer. Okay, so here are the medications. This is what you get from the pharmacy. You will get a container like this. This is what the compounded medication looks like. It has a tight fitting cap so it doesn't dry out. You want to always make sure you put that back on. And you have your double tipped applicators. If you have warts on the hands and feet, your medicine will come with this tape. If you don't have warts on the hands and feet, it probably won't. So here is our model to display how to put it on. If you're putting it on a large area, most people think it's easiest applying it right from the applicator. So you simply grasp it like this, and you put on a relatively thin coating. You can't really overdo it as far as putting it on too thick, because it's just gonna dry. So that gets the medicine on there, and if you want to fine tune it, you want to spread it right to the edge of the wart. You want to get it as precisely on the wart as possible. If you can't get it precisely on, it's better to go a little bit farther, go a little bit onto normal skin than to leave part of the wart untreated. And thick warts have 3 dimensions, so you want to get it on the top, but you also want to get it on the sides too. I tell patients it's like frosting a cake and not a cupcake. You want to get it around all the sides. For smaller lesions like molluscums or skin tags or keratoses, you use a different method. You squeeze a little bit of it, and you don't take it off like this. You use the fine end, and you put the fine end into the medication, and then you dab it on. I'm going to try to get a little bit more this time. You can usually do a couple, and you can treat several lesions fairly quickly. Or I just did 5 spots. And if you put one on an area that you don't like, just take the applicator, wipe it off. You use some tissues, wipe it up. And that's how you use it on small and large areas. Now, this medication, if it's put on a thin-skinned area like the face or the armpits or neck, it can sting for about 30 seconds. Most people tolerate it fine. For people who are more sensitive, who want to feel less pain, or for children who have a very low pain tolerance, at the store you can get numbing sprays with 20% benzocaine. They're available everywhere. You can order them online too. Put it on about 30 minutes prior to the compounded medication. Also, as your wart is treated, after a couple days, it will start to turn white as it's dying. It may even peel off, or part of it may peel off. People tend to pick this dead white stuff off with their fingers. This is a better tool. It's called the Cuticle Pusher. You can scrape the dead white stuff off, you can file it down, and you can pick it off with the pointy end. Always stop if it hurts, but getting this dead white stuff off will improve your treatment, and we have a link for this below. So for some final tips, warts are very fast growing. You don't want to skip days. That's the #1 reason why treatments fail. People skip days. So if you do skip a day, treat for 2 days more. Skipping days with molluscum or keratoses or skin tags is not good, but it's not as crucial as it is treating warts. And of course, let it fully dry. I'm Steve Leon, physician assistant from FixWarts.com, and I'll see you online.